Great, thank you, and thanks for having me. This is truly an honor. So, so as John mentioned, I think we've talked a lot about the airline industry, and you think about how patients or how flyers actually get into those seats. What are the technologies that drive consumers to Delta's website, to Kayak, to United, that actually then can power an application that allows you to change your seat and to change your flight, as I'm sure a few folks in the back are probably doing right now. Well, it's the technology that powers all of those things is what in more consumer industries would call marketing automation. It's technologies that create that logic that says that if I have this data point, send an email with this information and this image. If someone doesn't open that email, send a text message. If someone doesn't open that text message, follow up with a phone call. So those are the types of technologies that we're trying to bring as Change Healthcare to healthcare, so that we can take the data that is generated from all of those workflow systems, your EMRs, your scheduling systems, your billing systems, your access systems, and turn that into meaningful patient communications. So first of all, just going to start with what is Change Healthcare. Gotten that question a lot over the last day and a half. So Change Healthcare, we're actually, I think, the largest company at this table. We were formed from the combination of McKesson's technology businesses and a legacy business called Change Healthcare. And we actually operate some of the largest networks in the United States. We operate the majority of claims transactions flow through our pipes. We're one of the largest customers of the post office in sending print statements out to patients. And we offer a variety of whole suite of products around from everything from clinicals to revenue cycles to access and services in between. And so what's emerging about this technology? Well, it's I think what we're particularly excited about to talk about today is this ability to affect the patient experience, to affect patient communication through all of that data that flows through our pipes and flows through your pipes. So this is the problem statement slide in terms of kind of what we're trying to solve for. And if you think about this from a technology perspective, often you'll find that each one of these systems that are on the periphery of the slide here are different technologies. And even in organizations where they're the same technology, they're often different departments. And so when you're trying to coordinate a singular experience, even scheduling or follow-up, across multiple technologies, across multiple stakeholders, what you find is that every single department within a provider organization will be optimizing the communications for their own purposes. Registration will reach out to the patient with forms. Scheduling will reach out with an appointment reminder. Financial counseling will call the patient and try to arrange a prepayment plan. And from the patient's perspective, if you take your hospital administrator hat off and put your patient hat on, that can be 20 different communications that you receive for one singular appointment. And that can be confusing, that can be frustrating, and ultimately it doesn't really drive the outcome that you as the patient want or you as the provider organization want. So what we're doing is what we bring to the table is that experience layer that can drive all of those communications, email, SMS, print, phone call, that are generated from those different workflow systems, and be able to trigger notifications, trigger communications, trigger services, like some of the folks that you see at the table here, to be able to interact with the patient in a more continuous fashion so that when the patient actually interacts with these technologies, it feels as though it's a part of a singular experience, that the next step of the process was informed by the first three steps. The data that powers this is consistent, the language is consistent, the images, the branding, all of that can be consistent across that entire experience. And so you see a couple examples that I have highlighted here, but that's just a small sampling of the services that can be powered through a service like this. I think what we try to do is try to figure out where we can plug in to data sources, whether that be an EMR, whether that be a scheduling system, whether that be an optimization service like a Kairos or others, to be able to then use that information to trigger additional services, whether that be an email or whether that be a Medumo or a ZocDoc to present that to the patient. So we think about this kind of in a similar framework to what we discussed yesterday. Everything from awareness. We view the patient journey starting as when they first visit Dr. Google, when they experience that first symptom, all the way through the experience, all the way through the scheduling, all the way through follow-up, and ultimately bringing that patient back into the system through ongoing loyalty. And what's unique about this is that the same data that you all generate from a clinical perspective, that your access systems generate from a revenue cycle and access perspective, but then also from a consumer's perspective, preference data, behavioral data, patient-generated data, we can use to inform these communications, inform these services that we offer throughout the experience. So I've talked about this at a very high level, so I want to bring it down to a couple examples, because what we find is that although we bring a platform to the table, people don't buy platforms, they buy solutions to problems. So I'm going to just catalog a couple different problem areas that we focus on. So one here is the top of that funnel. So that's from awareness into the actual scheduling or the experience. And so this is a consumer-driven directory where, very much like a Yelp or consumer review site, we're able to allow patients to search for providers, optimize the providers that appear on this directory based on a matching algorithm on their proximity to the physician, the schedule that the physician has, so if they have availability in the next couple weeks. And then, critically, be able to route patients to this directory through outbound communication, SMS, email. And we find that when we actually push out that notification, consumers are 6 times more likely to visit this site and actually shop for a provider. One of the things that's interesting about this that we're implementing right now is what we find is that pictures of physicians are really helpful, information, reviews are really helpful. What's critical and what we're finding is that videos are really, really helpful. And more so than just, I think, that everything is moving to video. You have your Facebook and Instagram feeds. Your LinkedIn feeds are now all just autoplay videos. But from a patient's perspective, actually being able to know that they will understand the accent of the provider that they're going to see is critical. And having a 1-minute video where the provider actually says, introduces themselves to the patient can be really, really valuable in establishing that relationship with the provider, even in a digital setting. And then on the follow-up side of the equation, this is something that we're doing with radiology practices, where we can actually acquire the exam report from the radiology practice and parse out the need for follow-up based on what was in that text of the exam report. We then enroll the patient and the referring provider and do an engagement campaign, email, SMS. We try to shy away from portals as much as possible. We find that only about 30% of your patients, so 30% of patients nationally, will actually log into a portal on an annual basis. And that number drops precipitously when you think about that on a daily active user, monthly active user basis that we like to use out in Silicon Valley. And so we try to communicate via these more open channels and then drive the scheduling action. So although we don't actually provide the scheduling tool, we can drive patients to use that scheduling tool, whether it be in a portal, whether it be in a phone call with one of your schedulers. So that's ultimately what we're trying to provide, examples of ways that we can leverage data, clinical data, scheduling data, consumer data, to be able to drive value, both clinical value and financial value, back to our customers who are mainly providers. So thank you very much. Appreciate it.
So Spencer, interesting comment for you. So my mom is 81 years old. And I explained to her that in today's modern digital ecosystem that she could have full access to JavaScript object notation, available APIs to standardize the data flows to her phone, coordinate and be the steward of her own healthcare. And of course, she says to me, I don't know what any of that means, and why would I want it? And so I said to her, well, what if you didn't understand any of the technologies, but you could navigate the U.S. healthcare system more fluidly using your phone? Oh, well, that would be great. And so I think what you've heard from Spencer is you have to identify those things that are going to bring value to the patient and fill gaps today that are often smoke signals, Morse code, faxes, email, and all these other disjointed communication modalities. Well, we've left Oliver as a person to finish up our discussion of some of the innovators, and let me, Ken, tell you a quick story about what happened last night. So, in effect, I went to the restaurant equivalent of Kairos. I went to Ken and said, I'm a vegan, and I really want to get to the sort of best either Mediterranean or Indian cuisine in in Washington. And, of course, as you would have said, the best specialist is X. Oh, he said, well, let me tell you, the very best Indian restaurant in our region is Rasika, and it happens to be a quarter mile that direction. So that's great. Thanks so much for that. So I then did what anyone would do, which is I went to OpenTable. I went to the online version of scheduling to get access to this particular restaurant he recommended. And we were all going to sit at a table together, so I did a reservation for 5, and we were ending yesterday around 5:45. So I said, just give me Rasika today, 6 o'clock for 5. They laughed at me hysterically. Like, how was I to know this was a James Beard award-winning best Indian restaurant in the entire United States, equivalent to, in effect, Dr. Famous? And so then, after I tried using automation, I then called up the restaurant, and I said, hi, it's Dr. Halamka from the National Academy of Medicine, where I'm sitting with leaders in industry, academia, and government, and we're only here one night, and we've been told that you're the best Indian restaurant in America. Is there any way you could fit us in? And she said, let me check. Silence. Let me check. 6:30, table for 5, booked. Now, I tell you this because as Oliver tells us about how he automates a lot of these processes, in medicine, and I'll tell you, I oversee 4,000 doctors, so I know, there's the public schedule, there's the secret schedule, and then there's the super secret schedule. And the public schedule is what you see on a portal. The secret schedule is if you know the right person to talk to, and the super secret schedule is if you're the greatest donor, into the philanthropic, fundraising efforts of the organization. And how do you even begin to automate a level of complexity that has, in effect, just like I did with the restaurant, alternative channels to navigate different options? So, Oliver, tell us what you do.